Hi, Dr. Alex Perry here from the Perry Centre. Congratulations, if you're pregnant, you've just received the good news, or perhaps you've been pregnant for a while. Congratulations, it's a wonderful blessing, of course, to fall pregnant, but it's not without its challenges as well. And I wanted to talk to you quickly about a couple of the things that you might experience in pregnancy and which I may be able to help with. The first one really is aimed at if you're someone who's had a number of pregnancies and perhaps you're having some miscarriages along the way, you're struggling to hang on to a baby. Now, there's never any guarantees in terms of, doing treatment like acupuncture to try and maintain an early pregnancy. But I certainly have experience with women who have had multiple miscarriages. And it does seem, certainly on the numbers based in my clinic, that the rates of miscarriage in the clinic are significantly lower than they are in the population. So it may be something worth considering trying at least. So acupuncture is something that is used traditionally to try and help maintain an early and healthy pregnancy. So if you're struggling with recurrent miscarriage, you might consider including acupuncture as part of your treatment protocol to try and hang on to an early pregnancy. Now, if you've got questions about this, the best thing to do is, of course, to make a time for us to chat and to talk through what's happening to you in particular, and perhaps work out whether it's something we can help with. That's the first thing I'd really encourage you to do, and it's certainly something we do always with or suggest with patients who have been perhaps through fertility treatment in the clinic already, or whether they've been doing IVF or fallen pregnant naturally. We always encourage them to consider working with us for that first trimester to try and establish that early pregnancy. Now, the second thing that a lot of women struggle with is morning sickness, and perhaps that's the reason you've come to the clinic website today here at the Perry Centre. And if you're just tuning in and you're struggling with morning sickness, my name is Alex, and we're talking about pregnancy and particularly morning sickness. Now, morning sickness is not very well named for a lot of women. A lot of women experience the effect of morning sickness all day and sometimes into the night as well. So it's a bit of a misnomer in terms of the name. But if you're struggling with nausea or vomiting, you're struggling to get or keep things down, particularly fluids or food, perhaps you're already trying some medication or you're on the verge of doing that, you might consider trying acupuncture as a way of reducing the impact of morning sickness. And that's something that I have a lot of experience in. Now, there's no magic in acupuncture. It's a way of trying to change the way that your body deals with whatever's happening, whatever's going on in your body. But there's plenty of good research to suggest that acupuncture is good in treating nausea and vomiting. A lot of those studies are based on patients who are undergoing therapies like cancer therapy and so on. But the impact of acupuncture in terms of reducing nausea and vomiting does certainly seem in the research to be effective, and it's certainly something I've seen in the clinic over many years. Many women struggling with morning sickness, sometimes terribly so, do get very often some help from the acupuncture. So that's something worth considering as well, particularly if you prefer to take a natural approach before going down a medication route. It's not always possible to avoid medication for nausea and vomiting in pregnancy, but very often it is. So that's certainly something worth trying. So if you're struggling with morning sickness, let me give you my top hint straight away. Eat very small amounts very regularly. I think there's a correlation certainly between what's happening with the blood sugar in your body and its rise and fall, and hunger and feeling nausea and perhaps even vomiting. So eat small amounts very often is my number one off-the-shelf tip for you if you're struggling with morning sickness. But it's certainly worth a conversation. So whether you've had acupuncture before, whether you're even afraid of acupuncture or needles, but you're struggling with morning sickness, it's worth us having a conversation to see if it's something that we can help with. One of the other very common aspects of pregnancy, particularly as you're getting close to full term, that is certainly happening out there, and it may be happening to you, and that's having a breech baby. In other words, a baby that is not cooperating, it's going the wrong direction. Perhaps it's trying to go up instead of down, or perhaps it's laying, crossways, head one side or the other. if you've got a breech baby, then your chances of having a normal vaginal delivery are significantly reduced. In a day and an age where breech births are becoming less and less common, then having a breech baby certainly reduces your chances of even having a crack at a natural birth and delivery. So trying to turn a breech baby is a really important part of what I do. And Chinese medicine has been turning breech babies for, well, probably millennia. And it's again, there's no magic to this. It's about trying to get your baby into an optimal position. So if you're pregnant and you've just been told that your baby's going the wrong way, you've got a breech baby, then please give us a call and talk through your options. You can get me on 61624950. Now, whenever we're treating a breech baby, the timing is really important, because the deeper you are in your pregnancy, the harder it becomes, because your baby starts to run out of space to be able to turn. And if you're trying to do, or you're waiting for your GP or your obstetrician to do a manual turn of your baby, they often won't do that until 37 weeks. And in my experience, that tends to be too late, or getting on that point where the baby's really running out of space. Now, it certainly does work at that stage, but my suggestion is, particularly from a Chinese medicine or an acupuncture perspective, that we start sooner than that. My preferred time for turning a breech baby is between 34 and 36 weeks. That's the ideal time. It's early enough that there's still plenty of room. It's late enough that if we can get your baby turned and going the right way, then generally it'll stay in that position rather than flip back. If you do it earlier than 34 weeks, well, your baby's going to potentially turn over and over anyway. So I think 34 weeks is the perfect time. So if you've got a breech baby, or your baby's going in the wrong direction, it's certainly worth a try. In my experience, you know, there are some conditions that acupuncture is incredibly effective for, particularly in my experience here in my own clinic, and turning breech babies is one of those that I've got a lot of experience in. It's very safe, and the majority of women who go through this process in my clinic certainly have their babies going head down, and then they're back in the hunt for a natural vaginal delivery. So if that's what you're struggling with, then I really encourage you to call the clinic, at least have a conversation over the phone, see if this is for you. If you want to book in straight away, then you're more than welcome to. And the booking button is on the right side at the top of this website, and that'll give you an opportunity to make a booking. So those are the things that are most commonly a part of treatment during a pregnancy. Now, acupuncture is quite safe during pregnancy, as long as your therapist, your acupuncturist, your Chinese medicine doctor knows what they're doing, because there are certainly points that are contraindicated in pregnancy. Now, contraindicated just means that they are contrary to the thing that you're trying to do. In other words, there's a degree of risk involved with them. So you want to make sure that whoever's treating you, whether it's an acupuncturist, or perhaps even if it's a physio doing dry needling, you want to make sure that during pregnancy they know which points to avoid. And there are some significant ones. So remember that acupuncture is certainly safe, but I would encourage you to go to someone who knows what they're doing. Now, obviously, beware my own bias. This is what I do. I treat pregnancy with acupuncture, but I'd encourage you, if you've got questions, please give me a call or send me an email or get in touch. Be more than happy to speak to you about anything to do with your pregnancy, whether it's early on and you're trying to maintain an early pregnancy, whether you're struggling with morning sickness, or whether you've got a breech baby that's heading in the wrong direction. I just encourage you to reach out and ask your questions, so at least you've got all the information you need to make a good decision. My name is Alex Perry from the Perry Centre, Canberra's natural fertility and women's health clinic, and we've been doing this for nearly 20 years here in Canberra, since 2006. And you know, I really am very privileged to be able to work with women and their families throughout Canberra and the ACT and this local region, and I really love to be able to serve you too. So if you'd like to make use of my expertise, and then please get in touch with the clinic here in Deakin, 61624950. My name is Alex Perry, and you know what, I look forward to meeting you in the clinic real soon. And congratulations on your pregnancy. What an incredible blessing that is. even when you may be feeling a little bit, a little bit like it's hard work. There's no doubt that that's also true, but a blessing nonetheless. Anyway, hopefully we'll see you in the clinic soon. Until then, bye for now. Well, thank you so much for watching through to the end of the video. I hope that you found what you're looking for, whatever you're struggling with. I'm hoping from a women's health perspective anyway, I've given you some answers or some ideas of how we go about treating some very particular conditions here at the Peri Centre. If you're ready to make the next step, I've made it really easy. It's just a matter of hitting the big button directly below this video. It'll take you to the booking page, and really look forward to meeting you really soon.